My name is Dr. Baughman. I am a board-certified clinical neuropsychologist here at Semmes Murphey Clinic. So neuropsychology is a subspecialty of clinical psychology where really we are concerned with how the brain functions, whether it's things like memory or language or concentration or decision making. And I usually tell people the reason that I love neuropsychology is it's a nice balance between working on the medical side and working in mental health. And so we're kind of in this unique valley between the two where, you know, we primarily see patients with neurological issues, whether it's dementia or brain tumor, stroke, traumatic brain injury, but we get to spend a lot of time with our patients and we get to dig into areas that are pretty complicated. So things like mental health, behavioral health, cognitive health. And so I think all of that together is why I've kind of loved the field of neuropsychology and have never second guessed my decision. So the types of patients that I treat are pretty diverse. And so my practice itself is what I would describe as a lifespan practice. So I see kids as young as kind of elementary school age all the way up to older adults. And so as far as the types of patients or individuals that come and see me, they will present with things like dementia and determining whether someone might have Alzheimer's dementia or another form of dementia. I might see individuals who've had strokes or head injuries or other neurologic insults. In kids, I'll see kids that have had concussions. I'll see children where there's a question of whether or not they have some type of developmental difficulty like a learning disability or ADHD. So with regard to concussions, you know, my first experiences with concussions was actually when I was in training and I was working in the VA Medical Center. And so we would have veterans who would come back from war where they had experienced traumatic brain injuries. So a concussion is a mild form of a traumatic brain injury. After I joined Semmes Murphey, in around 2013, 2014, there was a law passed in the state of Tennessee that basically mandated certain steps that a person had to take in order to return to play. So this was targeting kids. And for the several years leading up to that, there was concussion legislation popping up in all the states around the country. And the idea was to make concussion management more visible and to create a safer environment for kids when they played contact sports. So back in the day, if you got a concussion, you know, you might be unconscious, wake up, or given some smelling salts, and it's like rub some dirt on it and you get back in the game. And we know from a lot of very good science over the years that concussions can have a pretty detrimental effect on how you function. And that can happen in kids, it can happen in adults as well. And so after 2014, the law in Tennessee basically stated that a medical doctor or a clinical neuropsychologist were the only individuals in the state of Tennessee who could clear somebody after they had a concussion to return to play. And so I started seeing a lot of patients after that, and that's continued over time. Now, typically with management, if you get a concussion, oftentimes the first thing that'll happen is you'll go to the emergency room, or you might wait and see, you know, your primary care doctor or your pediatrician. Where I come in is usually further down the road. Now there's some kids or adults where after they have a concussion, they're slow to recover for some reason or another. And so I might come in a couple weeks down the road or a month down the road where if someone is still struggling with concussion symptoms, we'll kind of lean in and start to assist with evaluation and management. And so with concussions, you can have a lot of different types of symptoms. So you can have physical symptoms like headaches and balance problems. You could have sleep and energy problems, but you can also have things that are very squarely in the area of the neuropsychologist. So changes in thinking slower, having memory problems, having problems with attention and concentration, but also emotional symptoms. So getting depressed, becoming anxious, getting frustrated and irritable. And so those are the areas that we are working with kids and adults on to better manage and just get back to feeling normal again. With regard to brain tumor patients, this is an area that's just been fascinating to me. And being here at Semmes Murphey, we are surrounded by world-class neurosurgeons, and so we do see a lot of brain tumor patients here. We know that a large percentage of patients that have brain tumors will experience some type of cognitive or behavioral or psychological problem. And oftentimes, we don't know why or how. The manifestation varies person by person. And so, as with everything in medicine, we're becoming much more individualized in our care and management. And so what I've tried to do is work closely with our neurosurgeons as well as our partners in the community with oncologists and radiation oncologists, where I am systematically meeting with patients, doing evaluations, providing education, and providing treatment for some of those common neuropsychological problems in brain tumor patients. Within neuropsychology, I think one of the things that we are blessed to have is time. We typically spend an hour or longer, sometimes multiple hours with patients and their families. And so I think what that allows us to do is to really stop and listen to our patients and to understand how whatever condition they are presenting to the clinic with, we are appreciating all the different ways that that condition might be impacting their life, right? Not only from a physical health standpoint, but from an emotional health standpoint, cognitive health, social health, functional health. And to me, that's absolutely critical in order to provide the most patient-centered care possible. I've tried to maintain a firm footing in education, training, and mentorship. I've been blessed with the opportunity to participate in national organizations in neuropsychology that involve education and training and mentorship. Locally, Semmes Murphey has been a training site for neuropsychologists for decades. So it's been an honor to continue that tradition, essentially training the newest generations of neuropsychologists over the years. And so in my clinic, individuals who are in graduate school for psychology will often come and rotate with us. We also have interns and residents who come and rotate with us as well. What I love about my job is every day is different. Like I said before, I have a variety of patients that come through my door, and everybody has a unique story. And so that is probably the one aspect of my job that I enjoy the most. One of the joys of working at Semmes Murphey has also been the autonomy. The leadership here in the clinic has been very supportive in allowing us to create our own practices, and I think that correlates with the level of care that we're able to provide. And so, that's, I guess, more of a contextual aspect of a job that I've really enjoyed over the years. With prospective or currently scheduled patients, we understand that being evaluated can be very anxiety-provoking. No one likes to be put under the microscope, and so I try to be very sensitive about that. I want to create an environment where we are able to answer the referral questions, but do so in a way that is respectful and reassuring to patients and their families. For potential referral sources, I want to have your patients. I want to take care of your patients, and I will try my best to be accessible and timely, not only in scheduling appointments, but getting some feedback to you. I think that's really important when it comes to supporting that optimal patient care.